Hello, Melamed community. We are back with another episode of Don't Let That White Coat Fool You.
Listen.
I am Dr. Norma Mobley along with Dr. Preventative Dixon, and we're here to engage with you again. Please don't forget to like and subscribe.
Yes, we want you absolutely engaged in the work that we are doing together. And when you like and subscribe, it really helps us to move our work along. And I don't know why I'm calling it work. We move this movement along.
That's right.
Yes, and invite your friends to be a part of it. We're excited to be here with you and can't wait to share more content as we go through 2026.
Yes. So, do you have any resolutions?
I always have resolutions.
And?
And I don't always make it through, but I'm going to make it through this time.
Okay.
I've had some great resolutions. You know, I was thinking about this the other day that my resolution is not so concrete this time.
Okay.
My resolution is I resolve to have experiences.
Okay.
Experiences.
I like that.
Yeah, things that I may not think were for me, I'm going to do. And things that I think will enhance my life. That's what I'm going to do. So
I may try to copy that a little bit because, you know, oftentimes I don't do things for myself that I might do for a family member. And I don't think about the finances until I'm getting ready to spend them on myself. That doesn't make sense, does it? But I do that.
And we have to learn to do that, have to learn to love ourselves as deeply as we love others. I think that's so important. This past December, I went on a vacation, I called it an experience,
Okay.
with a couple of friends, something I would have never done. I went to Finland.
Of all places, okay.
To see the Northern Lights. I had no idea, never thought about Northern Lights. Didn't know that this phenomena will probably not happen for another 10 years. And so I said, okay, well, you know, we'll see the Northern Lights. But this is one of my friends who does what I call extreme vacationing.
Okay.
It always involves something I don't want to do, hiking.
Oh, yeah, I know who you're talking about.
And so I wasn't so sure. But when I tell you, it was the bucket list item that I didn't know I needed. We went. We had sleigh riding with huskies pulling us.
Okay.
And I did snowmobiling. Never done that before. My oldest, who went with me, did gentle snow hiking.
Okay.
But I just knew, I was like, Finland, it's going to be 0 degrees. And I tell you, we were so bundled up and happy. But the most exciting part was when we actually went out and we were on our, I think this was snowmobile day. No, this wasn't snowmobile day. This was the day we were actually going to see the Northern Lights.
Okay.
And we get out on the trail, and one of the sleighs that was pulling some of our friends got stuck. And when it got stuck, I mean, we got stuck in the perfect spot. We looked up, Northern Lights started happening. And I mean, it was dancing across the sky. And
Stars?
even our guys.
Was this at nighttime?
Well, it's always nighttime in Finland, by the way.
Girl, I didn't even know that.
Yes. It was only like maybe 2 hours of the day that it was dusk. And then after that, it's dark. The whole time. But it was beautiful. And all of a sudden, these lights started dancing across the sky. And even our guide stopped and they pulled out their cameras. They said they had not seen it like that in years. So to have these opportunities
so
to
they
see,
didn't get stuck by accident.
Right.
God made sure you saw his brilliance.
I think so. And those are the kind of things that let you know that life is worth living, that we all have a purpose here, that there is something beyond us, whatever you call that, that I think are the kinds of experiences that will help me to live the rest of my life with the kind of purpose I want.
Well, guess what else is going to help you be able to live the rest of your life?
What is that?
Okay. we need to stay healthy.
Yes.
So one of my resolutions is that I'm actually going to go to the doctor this year.
How about that?
Okay. How about you?
Yes. Well, actually, I made that commitment last year as well. And, it doesn't hurt that sometimes on your health insurance, they'll give you a little break if you can show that you've had your visit for the year and you've documented all of your laboratory work. So don't miss out on those little bits of money for you.
Okay, so what we want to talk about today in regard to starting this year out right is what are some of those preventative health maintenance things that are recommended for us.
Yes.
Okay. And not just for us as women, but for those men in our lives as well. Okay. So it is recommended that you at least see your physician once a year, at least once a year.
We all can do that.
Right.
Just need to make it a priority.
So in regard to those maintenance exams that need to take place for men, your prostate needs to be assessed and you need to get a PSA annually starting at age 50.
Right.
Okay? Now, something else I learned, an abdominal aortic aneurysm screening. That needs to take place if you are greater than or equal to 65 years old and you have ever smoked. Not if you are a former smoker and stopped. If you've ever smoked at all in your life, even if you're not smoking anymore, is what I'm trying to say.
Right.
You still need to have that screening done. And it's simply an ultrasound. And it needs to be done for non-smokers if there's a family history of aortic aneurysm at approximately 50 years of age. So you would need to talk to your provider, men, to see if you are a candidate for that screening.
Wow. That's not one I was familiar with, so that's good to know.
Okay, now for us women, we all know that we need to get our mammograms done, correct?
Absolutely. And I've got mine done in December.
Yay!
Christmas
so
present to
everyone's
myself.
Always thinking about Breast Cancer Awareness Month, but these are the recommendations. All women greater than or equal to 40 years of age need to get their annual mammogram screening done.
Right.
Okay?
And we have to keep in mind, again, specifically for Black women, that we often have the worst type of breast cancer. We are diagnosed later than others. And sometimes our screening needs to happen earlier. So we need to make sure that we are on top of that and sharing that information with our provider. And if you really feel like you need one based on your family history, based on what you're feeling, you need to be your advocate.
And actually, if you have a family history of breast cancer, it's recommended to get your screening done before age 40.
Absolutely.
So again, you would need to speak with your provider and make sure if you're a candidate for getting that done sooner. Now, here's one of the exciting things that I read about. ACOG has made different recommendations about the pap smear.
Who is ACOG?
American College of Obstetrics and Gynecology.
Okay. Just making sure you all knew who that was.
Okay. So the pap smear is not recommended to be done before the age of 21.
Right.
Whether you're sexually active or not. It doesn't matter. So greater than or equal to 21 years of age through 29 years of age, one pap smear every 3 years.
Yes.
Isn't that wonderful?
I was excited to hear that.
Yes.
The last time my provider told me, okay, see you in 3 years. I was like, what? 3?
I know, that's
Thank you.
awesome.
Yes.
I used to tell my gynecologist, if ever they create a way for me to do my pap smear myself, he would never see me again.
Listen, I wish they could do it a different way than they do it, but
Right.
Still important for us to have it done.
Right.
Yes.
Now, the pap smear between ages 30 through 65, they recommend getting one pap smear every other year, or you can get your pap smear with the HPV screening done every 5 years.
Okay.
Okay. And that's if you've never had any problems and no abnormal pap smears in the past. And then the other change is if you're older than 65 or you've had a hysterectomy with no other past history, you don't have to get pap smears anymore.
All right. Well, that's important to know. And, we talk about this HPV, the human papillomavirus. That's important for us to consider. Because so many people have it and don't know it. So one of the ways we find that out is through your pap smear exam. And for those of you who may not know, HPV does put you at higher risk for cervical cancer. So we want to make sure that if you have that, you're keeping a good eye on the status of that particular virus in your body.
And then there's also prevention with the HPV vaccine. And what many of you may not realize is that between the ages of 27 to 45, you are still eligible to receive the HPV vaccine. So please talk to your gynecologist about that.
Yes.
Now, so these were gender-specific exams. Oh, there was one more, the bone scan. So for women who are postmenopausal, they recommend that you get your bone scan generally greater than 65 years of age. Okay? Unless you have a family history of osteoporosis or osteopenia, or if you are of a low BMI, which would be like 127 pounds or less.
So low weight. Yeah, that won't
low
be me.
weight. And then
I won't need mine until after 65.
And then also if you have other diagnoses such as rheumatoid arthritis, some immunocompromised type of situation, thyroid disease, or diabetes.
Yeah, we probably want to get it then. Yeah, there's so many things for us to think about with this, but that's why you need to have this relationship with your primary care provider so that you can and you can say to them, what preventative care items do I need to do right now? To make sure you're not missed. Okay.
So the colonoscopy applies to all of us. And thankfully, the age has been decreased. It's recommended that you get your first colonoscopy by age 45. Okay. And then it's to be every 10 years, unless you have a family history of colon cancer or polyps, then it should be done every 3 to 5 years. And again, you would speak with your provider to make that distinction.
I think one of the big things for us to keep in mind as, primary care providers or Black care providers, as I'm calling us now, and our community is that, unfortunately, many of these diseases, while some preventable, happen
or curable.
Right, curable. And they happen to us more often than they do others. So we want to make sure we're catching them, preventing them, or catching them early that we can have the best chance of survival. So don't forget.
Don't forget to prioritize your health in 2026.
Prioritize your health.